thanks everyone. We're going to start with questions now. The first topic is on a subject that's near and dear to all of us, health. First question, and I think we'll start with Secretary McGinty will be the first person to answer and then go down the line to the left, I guess. So far, Pennsylvania has not expanded its Medicaid rolls under the Affordable Care Act. Governor Corbett is looking to secure federal dollars intended for states expanding Medicaid to help residents pay for private coverage instead. His plan also includes a voluntary one-year program meant to encourage work. There's a possibility that the federal government will approve Corbett's plan before the general election. What would you do if that happened and you were then elected governor?
Thank you very much. Well, first of all, I think you always have to look at a person's track record. So here we have a governor who is proposing something called Healthy PA. Forgive me for being very skeptical. This is consumer beware. Why? This is a governor who, as Attorney General, fought tooth and nail to stop the availability of health care coverage. He's not changed his stripes. This is a governor who has presided over 97,000 people being dropped from our health care and medical assistance rolls. This is a governor now who has crocodile tears in terms of the CHIP program, Children's Health Insurance Program, when he presided over nearly 8,000 vulnerable young kids being lost from those rolls. So when he now proposes something called Healthy PA, I'm thinking it's a toxic brew and I want nothing of it. Dear Mr. President Obama, please do not say yes, just say no. Here's what I would do. I would definitely say no to the governor's plan. It amounts to a voucherizing of Medicaid, and what that means is that there will be fewer people covered, it will cost more, and the coverage will be less effective. That's not the direction we want to go. We want to expand Medicaid. We want to say yes to the $40 billion that should come to Pennsylvania as 500,000 people get that health care, and we want to move forward in a positive direction. Thank you very much.
Congresswoman Schwarts, and I'll ask to try to, if you could hold your applause until the end, I think that would be best and save a lot of time. Go ahead.
Sure. First, let me answer the question straight out. The Medicaid expansion plan that Governor Corbett has submitted to CMS creates obstacles, it reduces benefits, and it hurts people who are Medicaid or should be. I think it is morally unacceptable and it is not smart economically for him to have rejected those federal dollars, our taxpayer dollars that go to Washington, coming back home to cover 500,000 Pennsylvanians who could get health coverage today. But for Governor Corbett. So as governor, one of the first things I would do is to accept that Medicaid money, to make sure that we don't do what the governor, I can imagine he gets, actually gets this approved because it does create obstacles. But I would make sure that we get this dollars and we use it for our Pennsylvania residents to get health coverage, to do it right, to make sure that they have the benefits. They can't be successful without good health coverage, particularly this group of 500,000 Pennsylvanians. As many of you know, I worked really hard and successfully to find this way to get all Americans health coverage. We finally got it done under President Obama. It's something we should be proud of, and we should make sure that Pennsylvania implements it, that we take advantage of the Medicaid expansion, that we make sure that everyone signs up for affordable health coverage, and that we actually protect Medicare. That's what I've done in Congress. I'm coming back to be governor because I want to make sure that Pennsylvanians benefit from this new health law, all Pennsylvanians.
I oppose Governor Corbett's proposal. I believe we need to accept the 500,000 Pennsylvanians that need better health care. I mean, this is a common sense proposal. And even the very conservative governors across the country have adopted this proposal. It is federal taxpayer dollars that all of you have paid to the federal government that will finance this proposal 100% for several years, anywhere from $2 to $3 billion. Just think of that. We are denying our own resources coming back to serve our own people. It's ludicrous. This proposal is not a good one. And quite frankly, it is another Tea Party initiative, an initiative that represents a very conservative administration in state government. And not only is the executive branch conservative, so is the General Assembly. Whichever one of us are fortunate to be a nominee, we are really taking on an establishment that represents the Tea Party in an extremely conservative way, possibly more so than any state in America.
Listen, this is both immoral and inefficient. Immoral and inefficient. Think about this. First of all, we're depriving 500,000 people of coverage that's already been paid for. Already been paid for with your taxpayer dollars. They pulled back on something called disproportionate care that disproportionately covered healthcare providers in the southeastern part of the state, in Philadelphia, less affluent people who show up needing care. That formula has been pulled back. Taxpayer dollars have already been earmarked for this. Second, it's highly, highly inefficient what this governor is doing. I'm not sure if he's just misinformed or knowingly sucking up to the Koch brothers on this kind of stuff. But Medicaid is more efficient, not less efficient, than these short-term oriented profit-maximizing firms in providing care to those who currently are not covered, the vast majority of them. Why? Because they're designed to provide preventive care, social services, transportation, in particular, helping to drive armies of poor people away from diabetes. In the long run, we will all pay again and again and again for this misguided governor's approach to health care. We will do the right thing when Rob McCord is governor.
Thank you. Thanks, candidates, for sticking to the time. You're doing a really great job. I appreciate that. I would also be remiss if I...
We're intimidated by the warnings.
Good, yeah. I'd be remiss if I didn't say that the questions that we are asking were submitted to us by the many organizations that you see up here who have sponsored this event and edited with our help. So the next question is also on health, and it is, Pennsylvania prohibits abortion coverage in policies available in the health insurance exchange created by the Affordable Care Act. Where do you stand on that policy? And Treasurer McCord, we'll start with you.
Listen, we need to make private, personal health care decisions that women and men make. We need to make them private. I'm as profoundly pro-choice as anybody in the country. And it's absurd that we are subsidizing the consumption of Viagra and making it difficult for women to make their own procreative choices. And we can all bend your ear for about an hour and a half on this, but what's going on here is the Affordable Care Act did the right thing. You have right-wingers across the country trying to do the wrong thing, trying to claim somehow that employers should be making reproductive choices and birth control choices for their employees. I mean, what could be more wrong? What could be more un-American than that? So we need to simply respect that part of the law and stop, yet again, stop doing the wrong thing. And guess what? Yet again, it's not just immoral, it's inefficient. You do not want people to be having kids that they do not want to have, and you want to help prevent unwanted pregnancies, which are about 1 in 4 pregnancies. We want abortion to be safe, legal, and rare. It's the right thing to do. It's a smart thing to do. That's what we'll pursue.
Thank you. Secretary McGinty?
Thank you. Well, 2 things straight up. I absolutely oppose this legislation, and I would work aggressively and determinatively to overturn it. Second, that it absolutely needs to be stated, it would be suggested by this governor and others that somehow this is about taxpayer-funded abortions. It has nothing whatsoever to do with that. This is about whether individuals, and women in particular, have the right to shop for and choose the health care that is best for them. And this is about private companies offering that health care that women want to choose and select. That's what it's about. And the public should not be confused about that critical point. So you bet I would overturn this legislation. But you know, this is part of a much bigger story of this governor's absolute hostility to the rights, the abilities, the future, and the potential of women. If he really wants to stand for women, he can stand for the minimum wage, including especially a full increase in the minimum wage for restaurant workers and tipped workers. He's opposed 100% to that. If he wants to stand with women, he would never have cut the food assistance or put in place the programs that interrogate families that are just trying to put food on the table. You bet that's a woman's issue too. And when Tom Corbett proposes this legislation, you know what it's about. It's a right-wing agenda that's very hurtful. I oppose it.
Thank you. Congresswoman Schwartz.
Again, I'm someone, as you know, who fought during the whole debate on the Affordable Care Act to make sure that women had access to health services, the full range of reproductive health services that we need and might need to use. So I fought that fight. Many of you also know that I am not new to this issue. I actually, when I was pretty young, I was 26, I worked with other women to establish the Elizabeth Blackwell Health Center for Women here in Philadelphia, providing a full range of health services for women. So I'm someone, and I guess I'm the only one on stage who's actually done that kind of work that really means putting yourself on the line, sometimes literally, to make sure that women had access both to the health services they need, but to be sure that they were safe and that they were respected. And certainly, as part of health coverage, I worked in the state Senate to make sure that women had access to, because I pushed insurance companies to cover health services that were previously denied and seen as extras. And that was really an important thing to do. But I will stand up for women's rights. I will stand up for women's access to the full range of women's health services. I will make sure that they're covered under the health insurance provided under ACA through the private insurance companies. It is almost astounding to some of us that we're still having this debate in this country. It is time for us to move on to other issues to make sure that women have equal opportunity in this country, but certainly we cannot do that without access to the health services and health programs that we need to make sure that we can be all we can be. Thank you.
Thank you. Auditor General Wagner.
I believe that a woman should have access to safe health care under the law, the federal law and state laws. But I will be very frank with everyone. I'm a pro-life Democrat, but I believe a woman should have access to abortion for rape, incest, and life of the mother.